Hello again, Dr. Joseph Shamelian here. We're going to look in this video at how to replace distal free end saddles with non-removable crowns and bridges using keyhole mini implant dentistry. As undergraduates, the only technique we've been taught is that of a partial denture, a removable partial denture. But as we all know, for the majority of patients, they would love to have a better alternative than something removable. Conventional implants are very difficult in these sort of areas due to a lack of depth and width of alveolar bone. So the mini implant systems that are available certainly resolve these issues without any difficulties at all. So let's have a look at some of these cases. In this case, you can see that the lower molars are missing, as are a few upper posteriors as well, but we're going to focus on just the lower molar segment. Let's take a look at the ridge. You can see it's relatively narrow and rather unsuitable for conventional implants. The placement of these mini implants makes it a viable proposition to actually create non-removable crowns in this position. Here's part of an OPG that was taken following implant placement. And as you can see, the implants are placed such that they do not violate the inferior alveolar canal, and the upper implants are positioned to carry some premolars and molars as well. In this case, two zirconium crowns were fabricated, splintered together, and these were cemented in the usual manner using glass ionomer cements to create a beautiful result with normal anatomical contours which are very comfortable for the patient's tongue, far more so than a removable acrylic plate or a chrome framework. Just to complete this particular case, here are the implants for the upper jaw and the two replacement crowns cemented onto those mini implants. The final case looks like this. Instead of having a patchwork of missing teeth and especially no molars to chew on the lower jaw, this patient has now been rejuvenated with a proper set of occluding posterior teeth. Case number 2 is that of a patient with bilateral free end saddles. You can see the clasps of the lower chrome partial denture gripping around the premolars. In the absence of the partial, you can see the very large expanse of missing tooth structure there. Premolar and molars missing on both sides. 5 mini implants are placed in this area, and you can see there has not been the need for an incision, nor osteotomies, nor suturing. It's a bloodless field, very comfortable, easy healing, and very rapid recovery for the patient. The zirconium bridges, again, you can see are contoured in a very anatomical manner and cemented using glass ionomer cements. The image of the lower jaw, the mandible, looks fantastic now. There are no clasps, no acrylic saddles, no metal frameworks. The patient is completely free of her partial denture, and in a moment we'll have a listen to this patient's story of how desperate she was to have something done, something far better than partial dentures.
Hi. After years of horrific dental experiences and putting up with a lower metal partial denture for years, which I hated, I did a lot of research on the internet, went to see 3 other implant specialists. First ones told me I couldn't have implants, others said I needed bone grafts, and it was all getting so expensive and so hard. I was even going to go to Thailand. I was even, sent over some x-rays over to Thailand. I was getting pretty desperate, and then I came here and saw Dr. Shamelian, and he did a lot of checking and said yes, I could have these mini diameter implants. And of course I asked a lot of questions because some dentists said no, some said yes, and after he fully explained everything to me and the minimal procedure that would be needed, I thought, wow, this is what I've been looking for. And sorry, a bit teary because he was so good. And anyway, I agreed to have it done, and the cost was going to be a lot better than what I expected, and to be able to have this done in a couple of weeks without travelling to and from Thailand and things like that and stitches, well, this is great. Anyway, I came here yesterday very nervous, wondering what to expect, and it was really good. There was just a very small amount of pain, nothing that was any worse than what I'd had with any other dental experiences. I went home, to the motel, had a good night's sleep, and came back this morning where he completed the other side, and I'm just very pleased I came here. About 4 weeks ago I had the implants put in, and just temporary ones, temporary teeth to get me going for a couple of weeks till the real teeth, to replace them with permanent teeth. Had no problem with that, and now it's been around 2 weeks since I've had the permanent teeth in, and everything's going great. I found with Christmas Day I could eat everything, cashews, everything, not worrying. I didn't have to run off and clean them. I've had no problems whatsoever, and it just feels really good to get rid of a denture, and there's no pain, and everything feels natural. I'm just back here today for a little bit of fixing up and to make sure I've been cleaning them okay, and so far so good.
I hope you've enjoyed watching this video. It is very moving to think that we can have such an impact on the lives of patients who are so desperate to find a solution for this dreadful problem of having to have removable artificial teeth. Keyhole mini implants provides the answer to so many situations, far more so than any other system. Thank you for watching, and I look forward to sharing in the next video my very first case, which I conducted in 2003 for a 78-year-old elderly lady who was wearing a very large maxillary acrylic denture and really wanted to get rid of it desperately. And you'll see all of that in the upcoming next video. Bye for now.